Hi, my name is Simon Sekancha Nsubuga. I come from Uganda. I live and do business in Uganda. In October, November, I got sick. Started slowly. I got fevers and night sweatings. I got some preliminary investigations in Uganda, and I wasn't satisfied. Then I went to a bigger hospital in Uganda that did some tests. They realized that I had some inflammations on the lungs, but I was shocked when on 11th of November I was given a big diagnosis claiming that I had bronchocarcinoma, which literally means cancer, and I was shocked. I didn't see that coming, and I was speechless. The help of my sister, and we got to know one of the coordinators of a hospital in India, and that hospital happens to be Artemis Hospital. We quickly got visas, and the next day we were on the plane to New Delhi, and we ended up in Artemis Hospital. We reached Artemis Hospital on 12th November. Straight away we started with investigations. We went and saw a consultant in charge of lungs. I think it's called a pulmonologist. And we landed to the office of Dr. Sovanshi Goyal, who was very, very welcoming, and we gave him our papers from my country, all the investigations so far done, and we requested him that we are going to do everything again from start. He was very welcoming, and then we started the test the same day. The next day, we were taken to a PET scan. Definitely, I've never heard of it, and it was a very big machine and very scary. The report from the PET scan didn't talk about the cancer that I came with. Remember, I came with a diagnosis of cancer. The PET scan talked about inflammation. Then I started thinking otherwise. Then I did more tests. They took me through. They also did a biopsy. They did that bronchoscopy and did a biopsy on my lungs. They did another test called EBAS.
We had this patient, Mr. Simon, who had come to us from Uganda. When he had come, his main complaints were that he had very severe shortness of breath. He was not able to maintain his oxygen levels even on room air. He was diagnosed with a deadly disease, lung cancer, in his own country on a biopsy. This news made him shattered. So he wanted to have a second opinion from us, and he had flown all the way from Uganda to have our opinion. The moment we saw his CT scan and his findings, keeping his age in mind and his findings, we suspected whether it could be a wrong diagnosis. We wanted to confirm. Keeping that hope alive, we took him for a biopsy, a repeat biopsy by a very advanced procedure which we use in Artemis called the endobronchial ultrasound plus a bronchial biopsy. And to our surprise, he came out negative for lung cancer, which he was given a report in his home country. He came out positive for a disease called sarcoidosis. Sarcoidosis is a multi-system inflammatory disorder, not very uncommon but less commonly thought of. We as a team in the Department of Pulmonary Medicine at Artemis, we started him on the protocol which includes high dose of a medicine called corticosteroids and other anti-inflammatory medications. He responded beautifully to the treatment. His lung CT scan, X-rays, everything improved. He was able to move, do his regular activity. He did not require support of oxygen. Today, he comes to us for regular follow-ups, and as we stand today, this is almost more than a year. He has been with us on regular follow-ups, completely symptom-free. The whole new perspective what he has got in his life, there's no lung cancer, a disorder which has been treated. He is still on treatment with us, but this treatment is almost at a maintenance phase now, and what we look at with his young age, he has done really well with the disease of sarcoid, and hopefully he will continue to remain in this phase and continue his normal activity in his hometown the way he would be. And I wish Simon best of luck in his life and to do all his activities the way a normal person would always do.
My doctor, my consultant, Dr. Suvanshi, I can't stop thanking you with your team of consultants for the professionalism, for the experience, for the skill, and for being so kind to associate people that they come from Africa and you come with lots of problems. I mean, you can even call you anytime and you're always willing to. Sometimes I've been coming unnoticed, but you give me time. I'm actually over. I'm speechless. Thank you so much. At Temis Hospital, you have a very, very wonderful team. And in Dr. Suvanshi with his team, you have a big asset. I'm a big testimony of this, and I'm sure lots of people would want to have such a service. Please, if out there, if you have time, if you can get to India, please, Artemis Hospital is the place to come. They have the technology, they have the team, and they have the skills, and they have the customer service. Long live Artemis. Thank you so much.